Good morning, everyone. Thank you so much for taking the time to join us today for our webinar, Empowering Patients with Kidney Disease. A few quick housekeeping items. Today's webinar will last 1 hour. Questions can be submitted using the Q&A feature. If time permits, questions will be asked at the conclusion of today's session. And to receive the continuing education credits, participants must attend the entire webinar and complete an evaluation, which will be posted at the end of the webinar. Information about future sessions can be found at our website, www.kfohio.org. We would like to thank today's sponsor, Nephew, for this webinar. A little bit about the Kidney Foundation of Ohio. We provide a broad-based program of direct assistance to those with kidney disease, and we also help to promote and provide educational programming for the general public, renal professionals, and patients and their families. We serve a 32-county area in northern and eastern Ohio, and we have 2 affiliate chapters in Lake and Summit counties. The Kidney Foundation of Ohio remains the only health and human service agency in Northeast Ohio that continues to provide direct dollars to patients to help them manage their kidney disease. The foundation remains an Ohio-based organization, and all the funds that we raise here in Ohio stay in Ohio to help our patients. Without further ado, I would like to introduce Kathleen Perino from University Hospitals Transplant Institute. Kathleen?
Thanks so much, Molly. Good morning, everybody. My name is Kathleen Perino. I am the outreach coordinator for University Hospitals Transplant Institute. And I see some familiar names in our chat, and just hello to everybody and welcome. The UH Transplant Institute has been providing life-saving and life-changing organ transplant for well over 50 years now. Since that time, we've impacted over 4,600 lives, and this year we're on target for transplanting our 5,000th organ. So we're really excited about that. Our relationship with the Kidney Foundation of Ohio has helped us help our transplant patients by providing service and assistance, and truly helping them empower themselves as they go through the transplant process and beyond. We're excited to have the opportunity to co-sponsor this event, and look forward to hearing from Dr. Kang and Dr. Green this morning. So I'm going to pass things off along to them so we can get started. Thanks so much. I hope you enjoy the presentation.
Thanks so much, Kathleen, and good morning, everyone. As Kathleen mentioned, I'm Dr. Jill Green. I'm a medical science liaison with OTSCA's Field Medical Affairs team, and I have the privilege to co-present today with Dr. Rima Kang from Ohio State. She's a nephrologist who really truly cares about empowering her patients, again, for that improved outcomes. So today's presentation will discuss the advancement of technology through the 21st century and the importance of health information technology and the various platforms that are available at your fingertips that you can utilize to empower your patients. And really, this is ultimately to engage your patients, have them as a critical player in their healthcare, and improved outcomes. So as mentioned, today's program webinar is sponsored by Nephew, or Nephrology University. This is a community, it's a platform that OTSCA sponsors that helps bring everyone to the table to discuss relevant and critical topics in the kidney disease space. We hold monthly webinars to provide education to healthcare providers and advocates. You can see there's a list of various topics that we try and cover to stay relevant, whether it's chronic kidney disease and then related conditions, especially the mental health of these individuals with kidney disease. Optimizing patient care, which is kind of what today's topic falls under. Diet and lifestyle management, how those different techniques can improve outcomes for these patients with kidney disease. We specialize in polycystic kidney disease and other rare kidney diseases, and also electrolyte disorders. And so again, we, as part of the nephew community, this is, it's free to join. I encourage all of you to go to nephew.org and join today to access all of these free resources. In addition, you will have information available to you if you want to have some type of private or live programming, typically provided by someone from the field medical affairs team, one of my colleagues. And sometimes we're fortunate enough to also have providers such as Dr. Kang join us to give their clinical expertise in the topic. So again, I thank everyone for joining us this morning to discuss this topic and listening to my spiel about nephew. So today's objectives, we want to introduce the basics of patient empowerment. We're going to describe a little bit about the basics of chronic kidney disease, a little bit about polycystic kidney disease, and more so the additional burden and challenges that patients might experience with chronic kidney disease and those inherited kidney diseases. Recognize the potential of patient empowerment and how this really can improve the quality of care and those outcomes for those patients. And then the last bullet there, which is really the, I think, exciting part of this presentation that Dr. Kang will mention, is establish the health information technology, or HIT. Discuss the various HIT platforms that are, again, at your fingertips that you may leverage with your patients to deploy these patient empowerment techniques. So I will kick things off. A little history about patient empowerment. So there was an Institute of Medicine report back in 2001 that came out called Crossing the Quality Chasm, a New Health System for the 20th Century. And it really stressed the need to redesign U.S. healthcare delivery and really make it more patient-centered care. This report outlined a 10-year strategy to create safe, effective, timely, efficient, equitable, and patient-centered care. So again, we started to develop these strategies and ways that we could have, instead of that transactional healthcare delivery model that was previously in play, how can we really create value-based care and really, again, bring the patient into that discussion, have those shared decision-making conversations where they're a major player in their healthcare outcomes. Fast forward almost 20 years after this original report came out in 2019, a really pivotal piece of legislation that came out in 2019 was the American Kidney Health Executive Order. And this order stated that the care of the U.S. patients with chronic kidney disease, and ultimately those patients that were undergoing renal replacement therapies due to kidney failure, it really was unacceptable. And we listed policies that may lead to improvements. And again, it really brought in a lot of these elements of value-based care and how we can bring patients to the table, have discussions about the options that they have, and then have a shared decision-making conversation in where patients are empowered and that can choose ultimately the course that they would like to receive. So as stated, previous care models really focused on optimizing processes within the four corners of either the hospital or the outpatient clinic, in which patients would typically meet with their provider. But as we all know, patients with chronic disease can spend almost 5,000 hours a year in healthcare related activities that include those when they're meeting with their provider within the hospital or clinic, but then also those hours that are spent outside of the clinic, right? So when they're in their home, there's some items here listed. So diet, medication, making sure that they're taking the correct medications at the right time, exercise, if that's part of their, healthcare regimen, daily activity, and then of course medical advice. So there's a lot of different pieces in play that these patients with chronic kidney disease or even kidney failure that are undergoing some type of renal replacement therapy, a lot of their healthcare is delivered outside of those four walls of the hospital or clinic. And provisions in the Affordable Care Act, or ACA, encourage HCPs to engage patients in effectively managing their chronic conditions. And so some models are listed here: patient-centered medical homes, accountable care organization, shared decision-making practices, as I mentioned before. So again, making sure that those patients that are afflicted with chronic kidney disease or even kidney failure, they have a seat at the table and they're having open dialogue, and that they're empowered to have these conversations with their providers. So what are some strategies to improve those outcomes? And really, you know, what this whole conversation today is about is bringing that patient to the table, right? So previously, most improvements in healthcare outcomes were attributed to the clinical providers, the operational, financial process changes. But really, those patients could be that missing piece that can contribute to their healthcare. And if they're given those tools, information, technology to improve their incomes and outcomes, to improve, you know, they're empowered to, you know, have a seat at the table and have those discussions. It really can shift that balance from putting it all on the health system and the healthcare providers, and having a much more broad reach when patients are at that table and have those discussions. So what is patient empowerment? So patient empowerment denotes that life cycle process that increases patients' knowledge, confidence, and self-determination in their healthcare. So patients are gaining control. A lot of times, you know, patients, when they're diagnosed with chronic kidney disease, there's a lot of change that happens. They have to change their diet, their lifestyle. Maybe they're faced with their own mortality. And again, they may feel like they're losing control. This empowerment process gives some of that control back to them so that they can make those decisions and take action in improving their own health care. So kind of as we work through the process, research suggests that with knowledge, patients are more likely to develop confidence. And then with that confidence, patients can be motivated and gain self-determination abilities. That self-determination then empowers those patients to seek more health information, acquire more knowledge, and become more confident, right? So knowledge is power, right? And then with that accumulated knowledge, that confidence and that self-determination, patients may take more responsibility for their health and be more involved in their treatment. So they're more empowered, they feel confident in kind of what they have learned, and they can have those open dialogue conversations with their providers to discuss different options and the best course for their healthcare. But we also can't be blind that there are different factors that can affect this process, right? So it is a dynamic process that depends on various factors such as patients' race, ethnicities, cultural background, and community characteristics, right? So whether there's trust in the healthcare team, whether they have access to the technology that we'll discuss today, ethnic, if they're an ethnic minority, gender, age, etc. So how does all of this patient empowerment, how does it relate to kidney care? And I'm sure all of you that are tuning in today, right, we all are aware of the various challenges associated with chronic kidney disease. Patients with CKD can live with fears and panic, knowing that CKD is a progressive disease and can end in kidney failure. So we had talked about that, right, that it really is a journey from diagnosis. There's a lot of changes. They may have new medications that they need to adhere to. Diet is a huge one that, again, a lot of this is a completely different lifestyle change. They may be faced with their own mortality. And again, they need to kind of process all of these different challenges before they can take action. It's not uncommon for patients to be adversely affected by pressures of the stress. And then to take it a step further, as I mentioned, we specialize in polycystic kidney disease. So this is just one form of an inherited kidney disease. And that adds additional kind of emotional burden and psychological impact on these patients. So the diagnosis in itself can be devastating, understanding the disease, understanding, again, all those stresses that come with having a chronic kidney disease. But an additional layer is that it's in an inherited form, right? So they may have fear about their own diagnosis and progression of disease, but then also the emotional burden of potentially passing this disease on to their children. So again, empowering those patients can give them the ability to cope with those negative feelings and really take those steps in educating themselves, building confidence, having better discussions and shared decision-making conversations with their providers. And then finally, chronic kidney disease is an expensive disease, right? It taxes the health system burden. So this healthcare utilization, kind of the top half of this grid here, as CKD progresses, the more and more taxing it is on the healthcare system. Patients may have increased hospitalizations as their disease progresses. And then kind of the second half of this grid really talks about the quality of life, right, of these patients. So as the CKD progresses towards kidney failure and then ultimately either dialysis or transplant, there are many instances where those patients will have to miss work. They are unable to, potentially, if they were the breadwinner of their family, they're now unable to work and kind of fill that life role in their family. So again, it can be not only, monetary that it's taxing on the healthcare system, but really those patients and their quality of life decreases as this disease moves on. And then how are we going to change, right? We need change in the legislative side and having discussions with policymakers to, again, take these patient empowerment techniques and apply them specifically to patients with kidney disease. So as I mentioned at the very beginning, an executive order in 2019 was associated with this major investment in improving kidney care from policymakers. And it had various components of it. The first component was really preventing kidney failure, so slowing down that CKD progression whenever possible. The third one there listed increase access to kidney transplants through regulation, updating regulation. But that second one listed there under bullet B is really to increase patient choice through affordable alternative treatments for end-stage kidney disease by encouraging higher value care and educating patients on treatment alternatives. So again, they recognize that that patient may be that missing piece, and that if we bring them to the table, have a discussion, empower them, provide them confidence, we can improve outcomes. And with that, I'm going to pass it over to Dr. King, who will discuss various health information technologies that we can utilize and leverage to empower our patients.
Thank you so much, Dr. Green. And again, I'm Dr. Rima Kang. So we'll be talking a little bit more about health information technology and how we can use it for our patients. Next slide, please. Okay, so we'll start off with the definition of health information technology. It includes that patients use electronic educational material or online resources. They can communicate directly with their care team. This means that they can make medical appointments online, they can request refills for prescriptions, and oftentimes have direct contact with their healthcare providers. I think most of us are aware of patient portals, and most healthcare systems do have a patient portal where they can create a login, view all of their results, and kind of have this more interactive care with their care team. So again, that's the next bullet point here, become a member of their own care team. So a lot of these portals actually have all the members listed on their patient portal. So it's a good way to kind of streamline their health and really be involved in their own care. So again, managing their own health through electronic home monitoring devices, apps, or online tools. So we'll touch a little bit more about which specific apps and online tools can be used. They can interact with other patients with similar health conditions as well, which can be a really powerful thing for individuals with such a taxing disease and a disease that's associated with a lot of mental health issues as well. Next slide, please. So what are the goals of health information technology? We want to shift the patient-provider communication paradigm. So as Jill had mentioned, this is what our focus is over the long term. So much of the patient's care actually occurs outside of those four walls, as she'd mentioned. Outside of that, 15, 20-minute office visit, we really want to integrate the care with patient and provider. So we want to provide them with the tools to take over their care, because again, majority of which happens at home, whether it be dietary, lifestyle sort of interventions. So again, this improves health outcomes. We want to deliver information to consumers, and we want to enable our consumers to take more responsibility for their own health. And overall, this does reduce healthcare costs. As Dr. Green had mentioned, we have to kind of, shift the focus so that we do have less of a burden on the healthcare system as well. This increases consumers' awareness of their health-related activities and encourages healthier lifestyles. So overall, patients who actively do participate in their healthcare, they have better outcomes, and they were actually noted to have a better or perceived better quality of life as well. Next slide. So let's take a little bit closer look specifically at what some other institutions have done. This slide refers to what the University of Arizona had done on a project for diabetes. Their goal was to basically create an all-encompassing or one-stop shop for the care of diabetic patients. It was called Diabetic Link. So they wanted to sort of have this all-encompassing care on the part of healthcare providers and patients. So we're looking at, a place where there's education materials, where patients can communicate with other patients. So there's that piece of support as well. Risk prediction tools, and having access to credible diabetes sources, which can certainly be an issue anytime we're accessing social media or other avenues for health information. So basically, they're looking at a couple of research objectives here, which were cyber-enabled patient empowerment, so looking at symptom disease treatment extraction, health sentiment analysis, and evolutionary topic extraction. And then another one of their research objectives was personalized healthcare and community mapping. So looking at health interaction network analysis, health community mapping and visualization, patient portal implementation, and mobile apps. So again, sort of just an all-encompassing type resource that can be used to employ this HIT into the care of patients. Next slide, please. So health information technology provides an avenue of great opportunity for the care of our chronic kidney disease patients. It's an area in which I think we actually are lacking. And if you remember, Dr. Green had mentioned, there's so many barriers to which we have to sort of employ these techniques as well. If you remember, some of our barriers, including socioeconomic status, poor health literacy, trust in the healthcare system, a lot of that stuff can play a role in terms of our patient population specifically using health information technology to get that comprehensive care. In any case, chronic kidney disease is a broad term for disorders that present with kidney damage markers or decreased GFR. So I think most of us kind of know what that means. I won't get into the details of that. But more than 70 million individuals worldwide have chronic kidney disease, and most of these patients reach end-stage kidney disease and may require dialysis or kidney transplantation. So basically, greater specific knowledge is associated with improved self-management in patients with chronic kidney disease. However, patients with CKD are often dissatisfied with their ability to communicate with their healthcare providers, or just unaware of their CKD diagnosis or its implications. I've seen many patients before, whether they are referred from primary care or if they've been seeing a nephrologist, for a long period of time. A lot of times they don't understand, what stage CKD they have, what that means, how they will progress. And unfortunately, that's an area that is lacking, and we can certainly use some of these tools to help improve their knowledge. So integrating these novel health information technology platforms into routine care could enrich our current strategies intended to improve the often poor outcomes associated with this population of patients. And again, slowing chronic kidney disease progression is obviously everything that we do. This is what we focus on. This is, our focus of health. It requires a significant personal involvement of CKD patients, right? Because they outside of that office visit, it depends on medication adherence, it depends on lifestyle factors, it depends on diet, so much of which they can learn, just from these tools that we have. Next slide, please. Okay, so what are some of the resources that we can use for our chronic kidney disease patients? So we obviously have online patient education resources, and I'll sort of delve into the specifics of those and what you can use in your own practice. There are live and online social support services, and this is really important. This is kind of a piece that they won't even get in the office or, outside of these sort of avenues, because this is a critical piece that is offered actually by some of these online resources, where there are links to social support groups, whether they're virtual or in person. And again, I'll mention those in a few slides. Next are smartphone apps, which I'm sure we're all very aware of. And these can also be difficult to employ in practice, because there are, hundreds, of apps out there, especially specific to chronic kidney disease. The question is, which one of them are legitimate sources that we can use, or apps that we can, suggest to our patients. And I'll touch a little bit about that as well. And then lastly, social media. Of course, we're all aware of this: Facebook, Instagram, Twitter, which can all be useful resources. And just, I know we're sort of focusing on patients and patient empowerment, but I will say on the other side of things, as a healthcare provider, we also use a lot of these resources to educate ourselves. In fact, in the education world, many papers out there about using Twitter to educate ourselves. I can just say, for myself, I can quickly read a visual abstract and educate myself on the updates in, any number of areas of chronic kidney disease or just nephrology in general. So again, valuable resource for both patients and healthcare providers. Next slide, please. Oh, thank you. All right, so let's talk about education and patient empowerment. So literature review found that education was the most popular method of patient empowerment. The benefits of patient education include improved self-awareness of patients' conditions. So again, when these patients have self-awareness, they make informed decisions, there's better compliance, this improves their care overall. Maintenance of health and prevention tasks, increased adherence to medication treatment, to treatment plans in general. So as I'd mentioned, with better compliance. And then the last part is self-care. So these patients actually gain this sense of self-responsibility when they have that education piece. They gain trust and sense of control over their own disease. And that really influences how they take care of themselves, their outcomes, and their quality of life. Next slide. Okay, so we're going to spend a little bit of time on this slide because it provides a lot of useful resources that actually can be used in practice. And in fact, several of these I use myself. So one of the first websites listed here is Frameworks in Health and Quality. So this provides educational resources for patients and caregivers. Specifically, there are some resources for ADPKD. And again, the piece, this slide mentions that it's also for caregivers, which can also be important, right? Because, there also is like a toll on caregivers as well. So there are, resources for supporting caregivers as well. Next, we have NEFU, which Dr. Green had given us sort of a comprehensive, view about what NEFU does several slides ago. So obviously this provides resources on supporting patients and caregivers and guides for talking about kidney disease and many other related disorders that as she had mentioned, chronic kidney disease, anemia, obviously polycystic kidney disease. There's some information there about renal replacement therapies and electrolytes. So a lot of pieces that can be a useful tool, not just for patients, but also for providers. The next one here is one that I actually use quite a bit in my practice, which is PKD Foundation. So again, this is another one that can be useful for both healthcare providers and patients. So there are some links to Voices of PKD, so patients can really kind of gain some insight and hear stories from other patients who have the same disease going on. So there's that kind of like support and community component on this website, but also there are a lot of patient education materials. There are also links to the PKD registry, clinical trials that may be available to them, or those links or resources that they can use to see if they may be a candidate for certain clinical trials. So again, a really comprehensive website and a good resource for patients that I oftentimes refer my patients to. Next, we have here the NKF, which provides patient education materials. And this is also obviously another great source. A lot of topics about chronic kidney disease and dialysis that really sort of breaks it down at, a patient to the patient level, kind of puts it in layman's terms so that they may understand a little bit better. Okay, what does chronic kidney disease mean? What does it mean that my GFR is this much? And there are a lot of visuals on this website, which I think are very, very helpful. And, oftentimes in the office, I'll pull up some of these figures to show patients because that's a really powerful tool when they're able to visualize, okay, well, this is what that means. And this is the way my GFR is going. And this is the way, this is what stage chronic kidney disease I am. And of course, I think time becomes a factor. So this is such a useful tool. You can refer your patients who, most people have some sort of access to the internet in this day and age. And so again, that can be a useful tool to sort of, build upon what you talk about in the office. Next we have here is DaVita, which provides patient education materials and locations for treatment. So you can actually kind of research the different dialysis centers and kind of make a decision about, how you'd like to proceed with type of dialysis and your dialysis treatment services. There are also links on this website to these smart classes. You can actually, DaVita has its own patient portal as well, so you can view your labs. And again, most healthcare systems have that now. But the other piece that I really like on the DaVita website is there's like a food analyzer. So you can sort of type in the types of foods that you're eating and, maybe there's something that you find, I have chronic kidney disease. This is high in potassium and I've been eating this, I should stop. And I think, that's also a useful tool for us to provide to our patients, because I can't tell you how many times I'm scratching my head at dialysis, wondering why a patient is chronically hyperkalemic. They're telling me that, there's nothing from a dietary standpoint that they can figure out. But, maybe we punch this in, I've been, eating this new thing that I got at the grocery store, and lo and behold, that's the problem. That's the culprit. So, So again, really useful tool there. And I saw a comment that Fresenius also has a patient portal, and yes, thank you very much for that comment. So next resource we have here is AAKP, which provides educational resources, including a newsletter and recipes. So another sort of useful website there. And then lastly, we have Kidney School, which provides learning modules and audiobooks about kidney disease. I did forget to mention also with NKF, another thing that I find useful on the website is that they have links to podcasts as well. So yet another avenue in the health information technology field, not just online resources, but there are links to apps there, and there are also links to podcasts, and those are mostly kind of in the hot topics for nephrology in general. So again, that can also be a useful resource for providers. With regards to the apps, I like that NKF does sort of list out the apps that may be useful, because I find it very difficult to really find a legitimate app. And we'll talk in a little bit about when you're researching kidney disease type apps, hundreds of them show up, but which one of them are actually good? And so there is one mentioned on the NKF website about tracking your fluid. And so that may be a useful tool, obviously, in our patients with chronic kidney disease and end-stage kidney disease. Next slide, please. Okay, so next we'll move on to the live and online social support services. Social support allows patients to share and receive information and have their emotional needs met. Studies suggest that being in a support group could reduce feelings of depression and anxiety. So here are some of the live support groups that exist. So AAKP and DaVita offer in-person support groups across the US. You can actually, on AAKP website, you can search by state and find what resources, what social support groups are available to you. NKF's KEEP hosts screening events for individuals at increased risk for developing kidney disease. And local support groups, of course, as I'd mentioned, might be available as well. Again, if you just kind of search the AAKP site, you can find support groups that may be local to you. But again, we're talking about technology. Location doesn't really matter anymore, because there's virtual support groups as well. These online support groups to the right here. So online communities and support groups allow patients to share experiences. Some of the examples include Health Unlocked by NKF, Neph Space by NephCure, and Forums by DaVita and AAKP. And then the last bullet point here is NKF Peers is a program that offers telephone conversations with a mentor. So this can be very helpful. So those patients who have advanced CKD, those patients who are on dialysis, for patients who are having a hard time on dialysis and just need that extra support, this is a useful tool. Being connected with a mentor can prove very helpful. So again, a useful source to provide to our patients. As Jill had mentioned earlier, there's a large burden placed on patients, when they start dialysis, when they have chronic kidney disease. Their role in life may have completely changed. Their work roles may have changed. They may have gone from being caregiver to being the one who needs to be cared for. So these support groups can be a useful tool to provide to patients. Next slide, please. Okay, so the piece we all want to talk about, social media and patient empowerment. Approximately 76% of adults online in the US use social media. That's a pretty good staggering result there, which I suppose it's not surprising though, the way technology has gone, social media is a part of our everyday lives. It has created new opportunities for patients and families to actively participate in their care, self-manage their condition, learn from others with similar conditions. As we'd mentioned, a lot of these sites have that community health sort of aspect where they can get connected to other people and hear their stories and share their experiences. And it also helps to improve communication with healthcare providers. Patient engagement in these new ways has been found to promote positive outcomes by changing patient behaviors, impacting patient satisfaction, and overall improving quality of care. Next slide, please. Okay, so just to continue on social media and kidney disease, Dialysis Discussion Uncensored is a platform on Facebook for patients who are undergoing dialysis. So basically, it's a thematic analysis of user-driven conversations that revealed that this platform enabled patients to share their experiences and provide peer-based support for managing dialysis. So I'm personally not a part of this group, but again, kind of a useful resource for patients who again use social media so much. It can be a good place to sort of bounce ideas and get connected to others. Make the Kidney Connection is a platform on Facebook. It's offered by NKDEP to engage advocates for kidney disease in their networks and to connect with people with the highest risk for kidney disease. The NKDEP also manages a separate handle on Twitter, and that's for healthcare providers, where it positions itself for an authoritative resource for news and information related to chronic kidney disease. So, oftentimes I'll also see, NKDEP sort of tagged in a lot of these posts. And again, kind of another credible source that patients and providers can use. All right, so social media platforms can also be used to alert networks that someone is in need of a living donor. UW Health provides tips and an example post for social media use when looking for a living donor. So they actually looked at an app, and it's pretty neat in terms of donors. And you can kind of click through and say, I'm in need of this organ. And it's just a good platform by which to get connected to others. And another avenue by which an individual may get a transplant potentially. So I've had patients just say, I put up flyers at my church. I've, kind of canvassed the area or whatever it is. But social media sort of opens up this whole new avenue. Think about how many patients you can actually reach when you post on social media that you're in need of an organ. You may, get connected with a friend of a friend. And so you can just kind of reach so many more people through social media. Next slide, please. Okay, so finally we get to the smartphone apps. The number of health-related smartphone apps is growing, as we all know. Investigators who screened over 300,000 health apps uncovered approximately 300 apps that were related to kidney disease. So there's actually a paper that's called Got CKD. There's an app for that, which points out kind of the drawbacks to the number of apps and the quality of apps. So unfortunately, even though there may be 300 apps that show up when you search kidney disease, how many of those are actually legitimate sources that you can provide to your patients? It may prove useful in terms of, a patient being able to track their fluid intake, tracking their weights, maybe sort of simple things like that. But in terms of getting more complex, comprehensive, and evidence-based care, some of those areas are still lacking. In fact, when both patients and providers had sort of rated the apps, there was kind of this discrepancy in terms of like how patients had rated the apps versus how providers had, because some of these apps don't necessarily have, all the correct medical information, and it's really difficult to sort of censor some of that and make sure that that's all data driven. In any case, there are, again, that's why I referred to the NKF website, because there are some resources there which, do provide some help and good care to our patients. So examples of features provided by the apps, social media apps for communicating a need for a living donor, as mentioned, can be very useful. Again, you can sort of reach many more people through social media. Medication reminders can be helpful by using the apps. Skill training and habit tracking, symptom tracking, so whether these are active or self-reported or passive, which are sensor-based. illness management and supported care, health education, and tools for managing stress or anxiety. Next slide, please. All right, so next we'll touch on the importance of empowered patients, which I think also Dr. Green had mentioned, but we'll kind of reiterate this a little bit. So next slide. Okay, so we're looking at improving outcomes in our patients. So how do we do that? If they're engaged, if we empower our patients to make informed decisions. Studies have shown that patient engagement has been associated with increased adherence to prescribed treatments, functional status and faster recovery, levels of satisfaction, levels of health literacy, levels of positive health-related behavioral changes. So we want to empower our patients, not just with the tools that we provide them in clinic in our small little office visit, but again, having a full healthcare team of the physician, nurses, dietitians, any number of members of the healthcare team can help. And, of course, as we're focusing on that health information technology piece and providing our patients with those legitimate resources where they can, do some of this reading and spend some time on this on their own time, because again, all of this care sort of happens outside of the healthcare setting. So this really does help improve their overall care. And it was also associated with decreased diagnostic testing and expenditures. With that improved communication with our patients, we're sort of ordering less tests. It decreases referrals and decreases elective surgeries. Next slide, please. So let's summarize what we talked about with regard to empowering patients with kidney disease. Patients with chronic kidney disease can face many physical and emotional challenges during the course of their disease. Patient empowerment denotes a life cycle process that increases patients' knowledge, confidence, and self-determination of their healthcare. And empowering patients is associated with improved patient satisfaction, faster recovery, and reduced healthcare costs. Next slide, please. And of course, what we've talked about today, impact of health information technology. Education is the most popular method of patient empowerment, and there are many online education resources for patients with kidney disease, as we had mentioned. And again, there's just such a wide variety of things that are available even on each of those websites that really it could take a long time to get through all of it, but very useful for our patient population. Integrating health information technology platforms using online patient education resources, social media, smartphone apps, that can all help with regards to integrating care and improving outcomes in our patients. Studies suggest that being part of a social support group can reduce feelings of depression and anxiety, which are common in patients with chronic kidney disease. There is a large mental health aspect in our patient population, so that can prove very helpful. And then healthcare organizations can use data gathered from social media to gain real-time insights into patient engagement and empowerment, which can promote positive outcomes and improve patient care. Next slide, please. Okay, so lastly, we'll move on to any questions.
Okay, thank you very much, Dr. Green and Dr. King. That was an excellent presentation. If the audience has questions, please do put them in the Q&A feature so we can get them answered. I do have a couple of questions in the interim. How can families help support patients through the use of technology?
Sorry, is that for me? I'm assuming.
That's for anybody who wants to answer.
So I think that's a really critical piece here. A lot of family members are caregivers for our patients. And so it is kind of difficult, especially if, the caregivers aren't necessarily, and, some of the challenges, especially that we've experienced in the past couple of years, right, where family members aren't permitted to come into office visits, the patients are coming by themselves. That really has, affected our ability to kind of integrate care in that aspect. So that's why it's critical that, we provide our patients with these online resources. And again, as I'd mentioned previously, I believe it was the Framework website, which did provide resources for caregivers specifically. And, PKD Foundation has a lot of that too. So, I think families can also be referred, as long as the patients are sort of, providing their family members with, these resources as well. We educate our patients and they kind of pass it along. But, I think we are kind of starting to sort of reintegrate care and allow, with this COVID pandemic sort of, kind of dampening a little bit over time, family members are permitted to come into office visits again. And so we can sort of educate everybody at the same time that, these resources aren't just for patients, families, caregivers can all use, the same ones.
I'm so glad that question was asked, because that has been kind of a personal side project of mine that I've actually been working on with Field Medical, in that really acknowledging how critical the caregiver, care partner is and the community is in a patient's journey. So we've been creating resources again to first acknowledge that, and then also bring them in, have them have a seat at the table as well. So we're developing resources, and hopefully in August that whole project will launch. So I appreciate the question. And just from personal experience too, more in the transplant realm, and I assume UH is like this as well, is after the transplant takes place, there are online kind of support groups, virtual kind of networking get-togethers, not only for the transplant recipients, but also for family members, care partners, even on the donor side, and then also caregivers. So again, I know that it's kind of forced, the pandemic has kind of almost forced our hand, making sure that we are at least virtually having that component available to the entire family. Because as Dr. King mentioned, family members weren't permitted into the kind of normal clinic visits. So I think it's really important to make sure that we at least have an option to bring them in virtually to the conversation.
Okay, those were some wonderful answers to those questions. A couple other quick questions that I saw in the chat feature was, and this is something I've encountered in my practice as well too with kidney patients, is what do you do for patients that do not have access to a smartphone, laptop, or tablet? One resource that I have found in the Northeast Ohio area, at least based here in Cleveland, is PC for People. That does provide low cost refurbished tablets and laptops and things like that. So that's one resource that I would like to share with the group. In addition to that particular question, you had also mentioned too that yes, it is very important for family members to be involved, and especially with like hospital systems and things like that, how one thing I found too in my practice as well is to help get caregivers, be the primary contact to receive information, health information for the patients. Do you have any strategies or any advice to help further that aspect of care?
Sorry, do you mean like how to make caregivers sort of the primary point of contact?
Yes.
Or
Yes. Is there ways or any strategies to help with that?
Oftentimes that actually happens through a lot of these like healthcare portals. So you can sort of identify on the healthcare portal, almost like a surrogate or, any number of contacts that you want to have to release your information to. So that's really useful with a lot of these patient portals. So as a provider too who to contact and who to be educating as well.
Okay, thank you for that. We have a great chat going on as well too. And one of the questions is, that they found these resources and presentation to be extremely helpful. So we will be releasing a recording of the presentation after the event. If there are no further questions for Dr. Green and Dr. King, I think we will wrap it up. We would also like to just make an announcement in terms of more resources that will be helpful. The KFO is currently working on a transplant education video series that's in production. We hope to be releasing that very soon. That will provide education about the benefits of, seeking a transplant for kidney patients, how to go about doing that. That will be geared as a local resource for Ohio kidney patients. So please check out our website and social media channels for updates on that soon. As I said, that is currently in production. We are also hosting our 47th annual renal symposium in September. That will be September 22nd and 23rd at Wagner's in Westlake. So if you need some additional education and CEU credits, please feel free to register for that. Registration is open and that is available on our website as well. So thank you very much, Dr. Green and Dr. King. We really appreciate your time and information this morning. And with that, I think we're going to wrap it up. Have a great day, folks.
I could just one quick plug, I guess, for Nephew. I know a lot of folks were discussing in the chat about getting access to the slides. So if you become a member of Nephew, just go to nephew.org/join. It's in the chat. It's free to sign up, and then you have access to all of these different slide decks, resources, on-demand webinars, etc. So just a final plug.
Great. Thank you for that. And just as an additional reminder for those seeking CEU or continuing education credits, you must complete the evaluation that will be available at the end of the webinar in order to receive the continuing education credits. So thank you. Have a great day, everyone.